Welcome to Slice of Anecdote. I am your host. My name is Harry, and today we're going down memory lane with a friend of mine. His name is Bob, and we're going to share some experiences, perspectives of the everyday human. Hello, Bob. How are you doing today?
Yeah, good. Everything is fine.
Yeah, it's been a while since I've kind of seen you last, eh?
Yeah, it's around a year or half a year. I'm not sure. It's half a year.
I think I want to dive right in, if that's okay.
Yeah, sure.
Should we just kind of talk about how we met?
Yeah, I come to UK because I'm studying in physio, a master's degree in physio, and we met in the program in the physio. So basically, that occasions that we meet each other.
Yeah. When we first went into the lecture hall.
Yeah, lecture hall.
At the university, I think you were one of the very first person that was there. And there was like some other people. I don't think there was that many people, but like I was kind of sussing out and I was like, oh, I wonder if there's any Asians.
Yeah. They're probably everyone like Asian will think about the same things.
Yeah, because back in Canada for me, I only have white friends. So
True.
I kind of, when I came to the UK, I wanted to make a little bit of an effort to try to make some Asian friends.
Yeah.
And just so like it was like the BSCs and the MSCs, and then like we were all bunched together. And then there was like maybe like four of us sitting together.
Yeah.
And then we find out like, oh, the other guys are not with our class.
Yeah, that too is like from bachelors.
Yeah.
Yeah, and they're also from Hong Kong as well. I was a bit like upset on that moment, like, the Hong Kong people is just in the bachelor's group and not with us and kind of things. It's just,
Yeah, and it was really interesting because I haven't really hung out with any like international students back then when I'm in Canada, I think. And then just being able to speak Cantonese in a university or like a school setting is very new to me.
Yeah.
So I was like, this is so unfamiliar.
Yeah.
And I just thought it was like, oh, this is gonna be great. Like I hope like we're gonna, study together. And that's like basically what happened, right? Like we hung out a lot and we studied the course together and we just became like one of the pretty close people. Like we partner with a lot of stuff. I want to ask you, like, what was your first impression of me?
Well, I mean,
be honest.
I mean, the first impression, like, first of all, I know you are Asian face, but I don't really know you know Cantonese at all.
Oh yeah, I didn't speak Cantonese at first.
All.
Oh yeah.
Because your accent, like, very native, like Canada accent kind of thing. And then at the first, I just thinking, do you know like Chinese or kind of things? So first of all, I don't know whether you know Chinese. And I remember that like you sit on my back. And then I remember the first things I can hear from you is like the physio come getting into the student keep like walking into the hall. And the first thing you say, physio kind of dialogues. And I just think, oh, this kind of dialogue is just like this. I can only hear from like series from some kind of dramas kind of dialogues. And that's the first impression. I just know we have someone from Canada. This kind of my first impression on you.
Yeah.
How about you?
I think for me, I kind of like hid myself. I don't know if I want to reveal if I speak Cantonese or Mandarin. So I kind of like to look at how people react.
Yeah.
And when they try to like say stuff in front of me, and then just like, I'm just gonna pretend like I don't understand them. And then I might want to like catch them as a surprise. And I think that's kind of what happened. They're like, oh, you speak Chinese? It was like that small little moment, but it was kind of funny. But for you, I think I was like, oh, you're the only basically Asian in my class and you're from Hong Kong.
Yeah.
And like my impression of people from Asia study like really well and they're like really intense in terms of academics. And I was like, man, I could probably learn stuff from you, right? And I was not wrong. So yeah, it was great. And I thought like you're such a hard worker and you know so much stuff. I came from a very different background from physiotherapy, right? Mine's more like IT, but my other background is more personal training.
Yeah.
But you're very anatomy.
Yeah. Because I have background in sports therapy in Hong Kong.
Yeah.
And then, so that's why I've spent like 4 years studying kind of anatomies, exercises, all the things. So yeah, I would say my foundations, on that moment, I was a bit arrogant as well, like, because I'm confident about that. Like, oh guys, like, I know all the things like anatomy, those, like, to be honest, in MSK, I would say it's just really basic to me.
Yeah.
Because I've learned all over all this kind of thing. It's just kind of efficient for me.
Yeah.
So I would like a bit arrogant kind of.
Were you? You were so, at the surface, I felt you were very humble.
I mean, like, I know I need to be humble, like, but in deep, like, I need to control my arrogance. I need to be humble. Like,
I see.
Yeah, it's kind of like a fighting between my brain and my heart, you know? Like, you need to be humble. Like, I know a lot of things I don't know, especially like cardio, neuro. I have no idea what those kinds of things are. But MSK, I'm confident on that. Yeah, I'm just gonna say it out there for the world right now. Bob is so smart, so smart. So whoever is going to hire him, I'm gonna be so jealous, and you're gonna be in good hands. I just kind of want to understand a little bit more, since I didn't spend a lot of time in Asia. Are you okay to discuss a little bit about like life in Hong Kong versus the UK? What is that like in Hong Kong? In Hong Kong, I would say when I stay in Hong Kong, the only moment that I'm going to leave Hong Kong and go to UK, I really looking forward to the life in UK, because in Hong Kong, a lot of people, hustle and bustle, a lot of noise around you. You will be very frustrated when you're in like city centers. But when you come to UK, you stay here for a while, you will start to really want to go back to Hong Kong.
Oh, really? Okay.
Yeah, to be honest, that's true, because like, first of all, food.
Oh, yes.
Food. In Hong Kong, like you pay for like for £3 or 3 quarts, 2 quarts, you can already get some good noodles, food. But in UK, it is impossible.
No.
It is impossible. You can pay for £3, but you can only get meal deal. Like meal deal is not, to be honest, for me, is not a food for me.
No, it's different. It hits different. It's not like, Asian food. Like, it's not the same.
Even not talking about Asian food, like talking about like Japanese, like even like Western food. I feel like in Hong Kong is slightly have more choice, and if you pay more, you can pay, like, if you pay good, you can get good. But here, if you pay good, not really mean good.
Oh, true. Yeah, the quality is a little bit different.
Yeah. Like currently now, and my girlfriend always like spend time trying to find any good restaurant.
Oh.
But to be honest, it's hard. Like especially for Japanese restaurant, it's difficult to find a good one.
Yeah.
And in terms of life, like because Hong Kong is so fast, if you stay on the train station, wait for a train for in peak hours, if you wait for the train for 3 hours, 3 minutes, people start to get mad.
Yeah, it's like, the trains come really frequently.
3 minutes, you can get another train. Although now, like Metropolitan Jubilee is better, I think it's better, but some of the time you still have a lot of disruptions, signal problems. You still need to wait for a long while.
Yeah.
And the fee in here is too expensive.
It's crazy expensive.
Crazy, and then in Hong Kong it's much like affordable.
Yeah.
And now we get to more reality thing like salaries. Of course, salaries pay. When you know that you be a physio in Hong Kong, you can earn like 30K Hong Kong dollars per month. But here is.
Sorry, how much is that in pounds?
Pounds like £3,000.
Okay, so that's a little bit more.
Yeah, but it's just starting.
Yeah, that's a little bit more.
But Hong Kong doesn't have high tax. We got high tax here. So if you, after calculating all the tax, you can only like 20K here. So it's not really good, like comparing to Asian countries kind of things. But there's good side in UK because
like what?
Wait, I mean, like there are more people.
Yeah.
Where there are more different people, like nationalities, like
more
Indian,
more diversity.
diversity,
Yeah.
you can see, at least in the surface, people will showing respect to different countries.
Yeah.
But in Hong Kong, like mostly it's Asian, Chinese,
Yeah.
and some of them is Indian, but not that much compared to UK.
Yeah.
So you can see, in Hong Kong, you can have the superiority as a Hong Kong people. But when you come to UK, you will feel like Asian people is not superior compared.
It's minority.
More minority.
Yeah.
Not minority, but like just the status, the people, how people look at you.
Oh.
You feel like Asian is here, India is slightly higher, and then white is the top, of course. The
Okay.
British.
Yeah.
Like, you can have those kind of feelings as well.
Does it? Okay.
Yeah. So, but when you start to, like my friends, like my girlfriends, my partner, she kind of like a lot of some discrimination experience.
Yes.
Although I don't have that. But in Hong Kong, you never have this kind of feelings.
Yeah.
Come to UK, we start to have this kind of feelings. But
Yeah.
that's the point, because you live in the country that you are not born with. This is not your not your house. So that's it. Normal for me.
Do you think it's because our skin color or appearance, or is it there's other reasons why there's people like your girlfriend might be experiencing discrimination?
I think it's because I think some of the time it's not about your skin colors kind of thing. Sometimes it's because they think that I'm living here longer than you. So that's why I'm more experienced. I have the experienced residents in this country. Like I'm living here. Most of the time you feel like I'm living here longer than you.
Yeah.
And they will have some kind of superiority. But I have a theory of that. I think because they have lack of confidence about their identity as a UK resident, so they start to look down at you to gain more confidence on themselves. So that just my theory on that, but I'm not sure whether it's true or not. But I think a lot of time it's really not about your skin colors at all. Some of them is just because of the culture is like that.
Yeah.
Their parents' education is shaped their attitude on others.
Right.
So even two people from the same countries, they have different education, family backgrounds. They have totally different kind of reaction to others, like immigrants.
Okay.
I think really not about skin colors.
Yeah.
Although there may be some kind of, although there's some kind of factors, because people, when you see your Asian faces, the first impression you're Chinese, from China.
Yeah.
And in general, like social media or
the news,
the news experience, they will think Chinese is like really unpolite, and those kind of negative images start to form.
Right.
So when you tell them that you are from Hong Kong or you're from Taiwan, you're from Japan, they will be like more polite to you, to be honest.
They have like a slightly different perspective on those ones. Yeah.
They will think you're not Chinese, not from China.
Yeah.
So you are more educated.
Interesting.
They will feel you are more like educated. Like they will feel you're different. Like faces, like language is kind of the same, but different.
Yeah.
So they will understand about that.
Did you move to the UK just for uni, for your master's?
I think the starting point is from that. I tell my parents, I want to come to UK to study physio.
Why the UK, not other countries?
Well, that a really good question. Like my girlfriend always tell me, why don't you just study in Hong Kong? Hong Kong got physio degree as well.
Yeah.
But the competition between UK and Hong Kong is more competitive. You need to have some kind of experience. You need to have, because only one university in Hong Kong got the master degree in physio.
Yeah.
Despite there are a lot of bachelor degrees in physio, but at that moment, I just don't want to spend another 3 years, 4 years on a bachelor degree. So I want to go to masters. And then at the same time, I also think about Canada as well. But Canada, the prerequisite is so high. Like you need to study like psychology, statistics.
I know.
That totally not.
I know, it has nothing to do with it.
Yeah, you need to do a lot of prerequisite course.
Yeah.
And in terms of Australia is much more expensive
So expensive, yeah.
than UK. At the same time, their IELTS requirement is higher than UK a lot. Like Australia, you need 7.5
Yeah.
for overall
Yeah.
IELTS, but in my experience, I haven't got 7.5 in any of the modules at all.
Okay.
And UK only need 7. Because in IELTS, 7 and 7.5 is kind of big ranges as well. And then, so that's why at that moment I choose UK, because all of these factors like monies, requirements, all the things. And that's the major reasons I choose UK instead of Hong Kong or other countries. Yeah. And then at the same time, like after the BNO scheme came out, which is
the what scheme?
BNO visa.
Oh.
The BNO visa is when like people born before 1997, they got a passport from British government because it's like British national overseas passport.
Oh.
So it's like a special passport, but you're not a citizen.
You're permitted to come.
You can come. Like before that scheme, like BNO visa came out, BNO visa just like another passport. You got another passport, but it doesn't have like any means to it, just new like a passport from UK. But when a BNO visa scheme came out, you can, if you got a BNO visa, got a BNO passport, your families can move to these countries and stay for 5-6 years. You can be a resident. So that's why at that time a lot of people from Hong Kong moved to the UK, start coming to UK. You can see more and more Hong Kong people in UK. That's the major reason of it. And
was that when Hong Kong was given back to China from the UK? Was that the time?
Well, the time the BNO visa.
Yeah.
Is the time in 2022, because it's quite politics. Like at that time, Hong Kong, I'm not really recalling, like because at that time there's some politic actions which making Hong Kong people feel their freedoms
taken
of
away.
Speech is start taking away.
Yeah.
And then there are like people start to protest, a lot of protests happening.
Yeah.
Like at that time, even at that time, the protest is that really the first time that the protest affecting your school. You don't need to go to school.
Really?
You don't need to school because people like obstructing the roads, main the highway, train stations. People protesting is just like blocking all the things.
Wow. Okay.
Well, yeah, I don't comment on that, but it's just blocking all the things. So you cannot go to school, you cannot travel, you cannot like go to work. So at that time, that's the greatest protest in Hong Kong, I believe. And then after like 1 to 2 years time, the British start to recognize that there's like a statement between UK and the Chinese. I forgot what the English name of it. 中英聯合聲明, which means
I don't know either.
Yeah. Which means China confirmed, like agree that you give 50 years of freedom, that Hong Kong can have their freedom of speech. Everything is democracy kind of things. Keep that. Everything is keep that like the British style. Everything is keep that. But at that time, people start feeling that because it's quite complicated. It's just so complicated. But the major point is people feeling this freedom is taking off.
Yeah.
And then the British government also think that the Chinese is not respecting the statement. So they start to give you this visa to allow you to come. All of this is just politics, and then people, because of this, allow people come from Hong Kong to UK because of these visas. Yeah. And Canada also have the similar scheme as well. So most of the things happen because of that time, because of protest, democracy, politics.
Now your whole entire family is in the UK now?
My parents and my girlfriends is in the UK. Yeah.
That's amazing. Those are the things that's kind of interesting in terms of politics-wise. We can only kind of view it when I'm in Canada to see like, what's happening in what's happening in Hong Kong, and not necessarily be able to experience it, and you being able to experience it is quite a different viewpoint and insight, you know?
I think it's just like intuitive to Hong Kong people like nowadays. When I'm talking this kind of topic, you can see my words is quite careful.
Yeah.
It's so careful, like especially when you stay in Hong Kong. People nowadays, if you talking this kind of hot topics, whether you are supporting the Chinese or supporting the Hong Kong, if you really speak this kind of word really not careful, you will be like judged by the Communist Party or like people that are supporting democracy. So even in Hong Kong nowadays, when they talk about this kind of thing, is very careful. Even my friends and chatting in WhatsApp, kind of like phone, they will be very careful about that.
Yeah.
Because they care about like, when I some days, like even from UK, I come back to Hong Kong, will they catch me because like arrest me?
Yeah, they don't want to get in trouble.
Yeah, but that's why when you talk about this, it's very careful when people talk about this.
Makes sense.
You can feel that especially after this event happening.
Yeah, makes sense. I want to go back into like our uni life because that's where we kind of know each other most. Can we kind of chat a little bit about your whole overall experience moving to the UK in terms of like university at Oxford?
Yeah.
Like how is the uni there compared to Hong Kong? Do you feel like there's difference and like?
Oh, I would say because in Hong Kong, I am not really studying it's also higher education, because it's not a famous uni. Not like Hong Kong University or Hong Kong Chinese University. It's not like that. It's called, every time even the relative in Hong Kong ask me, where are you studying? Every time I need to explain it, it's quite trouble as well. Like I'm studying Technological Higher Education Institute of Hong Kong.
Okay.
So it's not a university yet, but it's institutions that, like a college that is having a bachelor degrees that is verified by the government kind of things. So I think the university life in Hong Kong will say, I would say it's more connected to others because everyone is same language. You will feel like more like a family. That the first impression when I'm in Oxford, I will feel like a bit, I won't say isolated, not people actively isolated you, but it just feel like we're not in the same kind of bubble, social group kind of things. I can have a really good sense of it because the topics we're talking about, like people, when you talk about some actors, kind of famous people, I have no idea who that is.
Yeah.
And then at the same time, you can feel like in terms of educations, like course structures, all the things, in Oxford, you can feel like they give you little of material, but they want you in the exam to be a lot. You can feel like, but differently in Hong Kong, they will give you a lot of resources to you, like lectures. Lecture looks. Have you seen like lecture looks like 100 pages in one classes? In Hong Kong, it's like that. Give you 100 pages slides, and then in the exam, most of the time it's around that.
The lectures.
The lectures. Yeah. Although they have some, depends on the lectures, depends on the exams. They will ask you things outside the lectures, but they will teach you. At least they will teach you. The most dumbfounded when I'm in Brooks, like in Oxford, they give you a cardiovascular lectures, the whole lectures and they don't teach us. They didn't teach us. I forgot what that lecture is, but they didn't teach you, but they test you.
Yeah, it was very hands-off in my experience, and I think I agree with you. It's similar in Hong Kong. So in Canada, it was. I will fully tell you right now, I try to stay away from textbooks as much as I can. Yeah. And I just study off of lectures, and like unless they tell you to do readings and like this is really, really important for you to like know for the exam XYZ, then like obviously I'll go do it. And then usually study off the lectures, you'll pass the exam and stuff like that, right? But I mean, you might not get like an A if you just study within the lectures. You might, if you're the type of person who's able to go above and beyond, then sure, you're gonna be able to get like an A+ or whatever. But I have the similar experience when I moved here to the UK, I was like, oh, the lectures are like really meh, but here's like all the resources for you.
Yeah.
But like, I'm not going to talk about it on the lecture. So like, you go read about it on your own time.
Yeah.
And go study it, and like you free ball like whatever you think is really important.
Yeah.
And I was like, wait, there's so much information. So that's why I kind of freaked out. And I was like, I don't know if I'm gonna be able to do this. 'Cause at the first like couple of months, I was freaking out. I was like, there's so much material and I don't know how to revise, because the way that I used to revise did not work.
Yeah.
So that's why I panicked, and then I consistently went on the internet. I was like, how do I do this? How do I do this? How do I do this? And then that's when I found the course, like I Can Study.
Yeah.
I was like, oh, this is how fucking people study? Like, this is mind-blowing to me. So like, and then I shared it with you.
Yeah.
And then you did so good in that course, and I'm still, in technique training. You're like, already finished, and yeah, you're so good at it and stuff like that. But that course really, really helped me.
Yeah.
Eye-opening like way of like how people study and stuff. At least for me. And
for me, of course. I think I'm still using it now.
Yeah, of course.
Yeah, and at least you have a direction to what to do, not just look at a book and scan it and revise it. At least you have some kind of motivations, know what to do, know the direction of it, instead of just going around.
Yeah.
But in terms of experiences, because now I'm studying other like uni or like institutions, I can feel it's a bit different. Now we give you a lot of lectures, 100 slides of pathologies as well. And
do you think it was just Brooks, or like, because you're in two different universities now?
I would say it's kind of Brooks as well. Okay. But my lecturers told me, current lecturer told me that we don't have time to do it. That's true. So that's why 80% is you, 20% is me. 20% is the lecturers, 20% is lecturer teaching you, and 80% is you go self-study.
Yeah.
But came out, the exam question is just around the lectures, all the things. There's not really things that, there's no things that you haven't seen it before.
Yeah.
But in Brooks, there is really something that you didn't expect at all.
Yeah, like there's like not even a keyword in the lecture notes. Yeah. And then it's like, oh, here's the exam thing. It's like, whoa, what the hell? Like, where did it come from?
I remember like one question in the cardiovascular.
Yeah.
It talking about a patient that is breathing very high, kind of things, like in the
increased rate of working.
In the A&E, which is a written question, and asks you what kind of condition it is.
Oh, that one.
That one.
Yeah.
And then after, even I know the question and check the notes, there's no answer on it until you search the Google.
Yeah.
But although one of our students can get it, but
just one of the students out of everybody in the class that got it.
And then there's no anything that's not making sense as well.
Yeah, and it doesn't really make sense.
Yeah, and if you talk about placement as well.
Oh, we're gonna go into placements. Don't worry. Yeah, let's just talk about placements, okay? Because this is like the meat and the grind thing of it. Like let's just go back. Like we were in physiotherapy together, and we were in the first year. Yeah. And then after our first year, we did
observations,
our placements and stuff like that, and then in our second year, that's when kind of can I say like shit hit the fan?
Oh, is it like a pivot point, like a great changing point?
Yeah, and I think for me and you as well, like there was things that happened, and let's just go right into like our second year placement. I had a little bit of a hiccup myself. Like I had to give up one of my placements, and just because I just wasn't mentally okay, and then that kind of led me to like almost failing my placement, to be honest. And my supervisor then told me, he was like, yeah, you can't continue, because if you were to continue, I would fail you anyways. And I was like, okay, I might as well like just give up this placement and try again later. So, and then we were in the same placement. Yeah. And let's just like talk about that. Like how's your overall placement experience? I quite liked it, but at the same time, I feel like there's so much stress for students to participate in like so much extra work. I mean, I get it. You have to be able to produce these work, produce the extra reflections, and allow the person who's marking you to have something to mark, right? So it makes sense. But I just think sometimes, I guess depends who your educator is. It's so different in terms of expectations, and it kind of threw me against the wall, and I was just like, wait, this is really hard, like just one of the placements at least. And then sometimes it just, things happen, and unfortunately, like you might just have better luck next time. But let's talk about you though. Like you had an interesting experience. Do you want to talk about the
for
surgery
sure.
one first?
Just share is fine.
Yeah.
For me, like I would say those kind of experience of course on that time is shit. It's unfortunate. But at that time I also figured out that the UK physio is not the things I thought about. Same. Like,
because when we think about physio, we're thinking like MSK clinic. And like here, the physio is like, well, also neuro as well. But like here, the MSK, the physio is very like respiratory and like hospital based, right? When I think about physio, it's very like private clinics and oh, you hurt yourself, you go to the clinic and do exercises and do those and rehab and stuff like that. But like this is hospital setting.
Yeah, of course, that totally different sense.
Yeah.
I don't care about emplacement. I think those kind of extra work for me is fine. Just extra work, I can do it. If I do it, I can pass it.
Yeah.
But there are too many subjective things on that. Like how it feels like I'm working in an office. Like I'm really working in an office. I need to care about how the impressions of the educator feel on you. Although I know I have some things that is not doing good. Yeah. I understand that, like, but at the same time, I feel like as a student, I should have the ground or kind of buffer for me to trials and errors, all the things. Because in the uni.
Sorry, can you say that again?
Like we have a buffer to tries and errors.
Trial and error. Okay. Yeah.
But I feel like in the placement, if you forgot to, like, let's say, forgot the blood pressures, you got one warning. And then if you forgot another time, you fail. Right. That my experience. Like, first of all, I quit the uni from Brooks, from Oxford, because I failed the 2 placements. The first placement I failed, I got the first warning, is because I didn't stand close enough to the patients, as the patient have some kind of neurological, like peripheral neuropathy, which the patient need to use the frame to stand. Although there's a physio assistant next to the patients, me next to him, and then the tutor wheelchairing behind. So at that time, I just feel I'm kind of safe to look at how the patient walking. And at that time, the tutor just told me that you're not standing enough, not closer. And then because of that, I take my first warning. Okay. And then after that, because the tutor think I didn't measure the blood pressures at that time, which she didn't. On my memory, she didn't warn me about that to say, hey, Bob, why you didn't measure the blood pressure kind of things. Right. She didn't tell me about that, so I don't know that. And this is the first placement that I really need to, like, even the second placement, I need to do things. At that time, I just feel like, okay, I need to do that. And then after that first warming, I also, because of that, I forgot to measure the blood pressures. I know it's kind of a really important things. If you're a physio, if you're qualified a physio, if you forgot to measure the blood pressure of the patient may have a lot of consequences falling can happen. I know that, I understand that, but as a student, I never thought about that. And then I guess we were never really taught, I guess, in school. It's like, oh, like, why is it that we need to take the blood pressure, and in what circumstances we should think about doing the blood pressure, right? Like,
we were kind of just thrown into the deep end. It's like, oh, you do blood pressure. Like for me, it was just kind of like, these are the sequences that you're supposed to take. These are the safety things you're supposed to do before we move the patient.
Like, and then, after those kind of warnings, like I remember I also got another warning. It's because I forgot the oxygens.
The oxygen tank, yeah.
And then the tutor asked me, do you think the oxygen tank is full? Because at that time I don't know where the like status locators of like indicators of the oxygen tank is. I just yes. And then because at that time I remember why I say yes, because I suppose if the tank is over there and there's a nurse around, I suppose the oxygen tank should be full, should be having oxygens. And the tutor just say, well, have you looked about that carefully? I say, well, and then I'm not sure. And she said like, no, it's empty. And then I get another warning because of that.
Interesting.
And then I have an argument with, like, after the school know that I'm going to fail, I have an argument with the lecturers, and I told them, although I have really touched the oxygen tank in ICU, but they didn't really teach me about, I need to look about the tank, whether it's empty or not, before I need to take it out.
Right.
I only know I need to take it out, give the tutors, and the tutors never talk about me all the things. I just told the whole things honestly to the lecturers and the educators, but they don't really care about that because they think you should know that, you should learn it from ICU, so you're supposed to know it.
Their perspective might have been very much like, oh, it's common sense to check.
Yeah.
But I think how can somebody have this type of common sense if they just don't know, right? Like you don't know what you don't know.
Yeah.
And I think it's fair if someone just doesn't know, and you just need to be able to tell them everything about the thing that they need to do. But like, it's so hard. I understand your perspective.
Yeah, and at the same time, I think, I mean, you tell me you have failed. Like, I mean, you tell me, like, you forgot to do this thing, do this thing, do this thing. I think it's all right. You just tell me, but don't give me a warning and don't give me a second chance to, because they're paying safety, blood pressures, oxygens, all is in the same category as safety things, but they are different things. Like they're same things but different things, because in terms of I can study, like it's a big chunk safety. And under safety, there are like different branches about that. But if you, because of forgot the blood pressures, forgot the oxygen, they would think it's the same things and give you two
warnings. Two same warnings.
Warning, They don't give you the second chance to, I remember at that time after I know that I forgot the oxygens, every time I take out the oxygen, I check it and tell the tutor, I check it. And then I measure blood pressure, I measure it, whether I'm doing good or not, all the things. And then they just don't care about that because I failed you already. So I don't give you another chance to do it. Fail is fail. So there's no any argument on that. I just amazed that I can still, because I failed on the half of the placement. And I think it's quite unusual be totally failed on the half of the, half on the placement. I'm not sure, is it unusual or usual things?
I have no idea.
And then I have no idea how can I tolerate that another 3 extra weeks that is like meaningless. That, although you can learn a lot of things, but it didn't change really much in terms of your result. I don't know how can I.
Oh, what you're saying is like she's already determined that you failed at the half point.
Like in terms of that is termination. Like you can do it, but I don't mark you anything after that 3 weeks. You can be here, I will kind of support you, but they won't give you any input? Mercy, like no more mercy on that point already.
Interesting. I think, that place was really, I would say was really tough. And I think like the attitude, it was really like on a different standard for a lot of students that came in, and maybe like me and you, we just had a really interesting experience. We both kind of just did not do well on the placements, and then we just kind of had to move on to a different placement, right? Like, I think the environment they kind of built, at least to me, it was more like, what is it that I can pick out from you that you're doing incorrectly, potentially even from like a non-safety perspective to potentially fail you, than to the environment of like, this is a learning opportunity, like this is not safe. Like, you've demonstrated you have to take the blood pressure, you need to look at the oxygen tank. And if you were to repeat the same task and you wouldn't be able to do it again, okay, fair. Like, that's a failable thing. But like each time you have like a different thing to worry about, you know? And like, that's how people learn. It's like, I don't know, I think about like parents. It's like, oh, this time you stole something, that next time you hit somebody. Like, those are two different like, what do you call it? Like sentences, you know? And it was just quite...
Well, at the same time, I can feel that I'm not sure whether other placement you have experienced is different.
Yeah.
I can feel that on the first placement, I know I'm not really, like, how to say, I feel like I'm still doing something like wrong maybe, or similar, like not similar, but something like not good, not a safety practice on there. I can still feel that they really want to tell you that, okay, it's not safe. Unless you're really, really, really unsafe, they will give you a warning. But if you just miss few things, like on the VLE, like what they call?
On the readings?
All the readings. If you forgot to read some readings before going to see patient and the tutor pick it up, they really won't give you a warning or what. They just tell you, okay, you forgot that one. Next time you just need to remember it again. And that's the education, I think. And then second placement, I like 1, 2, 3, 4, technically 4, the fourth placement. I can have a similar feelings of it. They just really want to pick you what didn't going well, pick anything that you do wrong, and then fail you because of that, because you're unsafe kind of things. They really not, my educator is not really motivative. I would say not motivative.
Yeah, it doesn't seem like they're there to teach you. They're not there to like teach you, but they're there to see if you can pass, or if you are there to pass. And I think maybe that's the difference of mentality in placements that I guess we just didn't know. It was like, oh, I thought going into placement was a way for me to, number one, learn my mistakes, understand what kind of mistakes that I'm currently having, but not to act as someone who is already qualified.
You need to, they expect you you're qualified.
They expected you to be like already qualified. And I mean, if someone were to tell me that like in the beginning, then I'm like, okay, like this is like a different mindset and a headspace going into the placement.
Yeah, true. But although you mentally prepared, but your skill, in terms of skill, you still have a lot of things that, although you think you may know, but actually when you do it, you're wrong. You never know it until you get wrong. And I think the things that is the most, how to say, make me feel is not education is, suppose we do reflection every time when you get things fail, and my tutor just get my reflection as an evidence to prove me I'm not doing good. Like how to say, so every time, like one time I forgot some contraindications for the knee surgery, which is unable to, like you cannot, I forgot it's extension or flexion after surgeries. But whether it cannot flexion or extension. At that time I forgot that one. And I write in my reflections that, where on my reflection that I forgot to do, because of that I may contraindicated to these surgeries, exercise kind of things. And my educators just say, you see, you write all the things on your reflection. It just make my job easy. I still remember her saying is, you make my job easier.
What the fuck?
You make my job easier because you write all what you're doing wrong in your reflections. I can take it as an evidence that's showing you're doing not good.
That is not okay. Hold on, like reflections are supposed to be a way for you to learn to reflect on the events that what you can do better next time.
Yeah.
Not as an evidence to mark a student down.
Yeah. That I have this, on that time I was, what? All right. So what I just want to, is at that time I didn't really speak out. I just say, so what I need to write on my reflection? Do I need to just write all the good things and then hide all the bad things? That's not the reflections.
That's not the point of it.
Yeah, that's not reflections. And then, even like, even in terms of, we have the CPAP on the halfway, and that the third week. And we meant that that's the third week of Friday, which is the last day of the third week, the halfway point.
Yeah.
And I just asked the tutor, can I get back my reflection, get back my CPAP? Until I've been failed, until I ask our tutor, our lecturer, that lectures to get back my CPAP. Until that time, I can see my CPAP. Until that moment.
So, sorry, I don't understand.
Yeah, so basically we supposed to get our feedback from the half point.
Yes.
We can receive our feedback on the CPAP on that half point.
Yes.
But I didn't get it until I get failed, until everything is fucked up, until I ask the lecturers to get my CPAP, how does it look like on my CPAP. On that time, I can see it until that time.
So they've already failed you before you got your halfway feedback for you to like work on the feedback.
Yeah.
For like the next 3 weeks of your placement.
Yeah.
They've already decided that you've already failed.
Well, they have a like discussion with me.
They didn't have a discussion?
They have a discussion. They have a discussion with it. So like we consider you are kind of like at that moment I think you fail because this kind of thing is not doing good.
What were the things that they said that you failed? So the contraindication with the knees?
Yeah, knees. And then they think about my tons of things like communications. They think my communication is not good.
Like, in what way?
Well, like communicating to, like not therapeutic alliance, like communicating to patients. Like,
I see.
Like, oh, you are doing good, you are really good, come on, like those kind of things. Like, how to say, like when you support moving a patient, you need to talk about encouraging the patients. You need to encourage the patient. Oh, that's good. How's your improvement? All the things.
Yeah.
That therapeutic communications.
You're right.
At the same time, they think.
I think that comes with experience though, which like we don't necessarily have.
But I think that is not the most core things. They think I'm not doing good. But the core thing is, of course, is safety.
Yeah.
It's still about safety. They think I'm not careful enough to take a look on those notes and seeing that patient is contraindicated to several things.
Okay.
And I remember the last week of placement, my educator, she told me that we are going to see that patient. Can you look at that notes for me? And I look over the notes and I'm frustrated, stressful, everything is come up. That although you can say it is kind of excuse, but anyway. But I look at the notes, I say, well, I tell the educators that I think this patient should be fine to go. And then the educator said, have you been careful? Have you careful enough to see that patient that you think, she tell me, have you see this thing carefully? Have you be cautious enough? And then I just walk back and see the notes again. And then at that time, shit, the doctor said, this patient is not able to go exercise or those kind of things yet because there's some kind of sacrum problems like dysfunction, like quarter equine kind of things happening on that patient. But I missed that notes.
Right.
And then my tutor say, she like, that's why I cannot pass you. Like, that's the reason I cannot pass you.
She's literally like leading you to your failure.
Yeah, like At that time, I just think that if you ask me to see that patient, which means like at the first instinct, you will think that patient should be fine. I just need to I didn't really care for enough. Although if you're qualified, you cannot be affected by anyone's. But at that time, she is my educator. I just think that at that time, I just think this patient should be fine. But I just skip that notes. I cannot see that anyway. I don't know why I cannot see that notes, but at that moment, she just think you're not good enough. Just saying that you're not, just keep proving you're not good enough.
I think her mindset was like trying to prove that you weren't good enough to pass.
Yeah.
But at the same time, I understand in a different perspective from a physio's point of view who's marking you. It's like, okay, like this student maybe not, detail oriented enough and does not pay attention to these things. Like if this student is this type of person, I don't know, if I was the educator, I would throw him cases. Here's like a group of patients. Can you go and look at their notes and see like which ones you can see and which ones you can't see? Can you go tell me why? And like let them figure it out instead of like, let's go see the patient and I want to see if I can determine whether or not you're going to fail. Like, I don't know, you can argue from like so many different points of view. Like we don't know what this educator is thinking at all, but like this is what your experience is, right?
Yeah, so. I mean, I think education is not like that. Like not picking out your, like even exam, deducting your mark is fine. Yeah. But it's not, deducting your mark doesn't mean you cannot improve, you cannot pass the things.
Exactly, yeah.
Like even I try my best in that 3 weeks and then showing that, I keep chatting with the patients, keep chatting with the team members. That really not the things I like to do at all, as I'm a really I person, like a MBTI, I'm a really introvert. I'm really kind of introvert type of people. Yeah. Like chatting with the patient, chatting with the teams, everything has really overwhelmed me enough. Yeah. And then, at that time, just so stressful. Yeah. Even that my kind of minor things on me, like I know that I always be careless on some kind of detail. I know that like, until now, I'm still really afraid of going to placement, like afterwards in year 3. I'm still really afraid that I will miss this kind of contraindication things, those kind of detailed things. But even in my observations currently in my study, even the student is failed something, forgot to ask some things, the tutor just say, oh, did you ask this some kind of things? They don't give you a fail. They just argue, okay, you just go ask it again.
Yeah, the approach and like the intent is very different. Yeah, so it makes the environment of learning is okay to fail because this is the environment I'm allowing you to fail, so then you can not fail when you're actually in like a real case scenario, right? So so even on that time, it's not about, after I know that I'm probably fail, me and my educator stay in the same room. I still remember that the first time I really cried in front of a tutor. And at that time I think the relationship between you and me as an educator and student should be ended. And then at that time I cry because I trust you as a person or an adult kind of type of things. I trust you, so I cry and I tell you that I'm stressful, I am under a lot of pressure.
Frustrated. It's not about you passing or fail me anyway. And then I really remember when I walk out from the room, she just told me that, just go to the toilet, wash your face, and then come and find me in the office. At the time, I just feel that it's so cruel. Why you will ask the student just wash your face? Do you know what I mean? Just ask the student to wash your face and come back to see me. It's so cruel. Like, it doesn't really care about my feeling. On that time, I can feel that. She just like feel, I can see the sympathy, not the empathy. I can see that, okay, I need to care about you. Well, why you cry? Why you stressful? Those kind of just like a
surface level.
Routinely ask you why instead of really care about that. And then when I really need to leave the office, go to take my stuff, the last thing she told me is, remember, to put all the patient details into the rubbish bin.
Okay.
Not even like any quote that motivating me.
Not like good luck with your next
Yeah.
pet expense, like you'll be fine. This is just like not like
Yeah.
your blah blah blah.
Yeah,
like,
the last sentence she just told me like, remember to put all the privacy detail papers into that like privacy bin. And then I said, okay, well, yeah, that kind of like she never remind me. That's the first time remind me about that.
Right.
To be honest, I just think that should not be the last sentence I should heard from you after fail all the things, everything.
Yeah, this is really interesting in terms of like how people are being like put into educator positions, and I don't think a lot of the people who are in these positions, it doesn't matter like what kind of health professionals they are, like I don't know if they sign up for it or not. But
I know
like,
that they are. I heard. I asked my friends, Hong Kong people working as a physio band 6.
Yeah.
She told me this is not voluntary. It's involuntary. You need to do it. You need to do it until you get promoted. You need to get promoted because of you being an educator.
Oh, you have to do it
You
for.
have to do it
I see.
for it.
But some people aren't like made to be an educator. Do you know what I
Yeah,
mean? Like
yeah.
they just want to like get their shit done.
Yeah.
And then like go. I think
would
you
say-
just had.
Yeah, just two unfortunate things. To be honest, after studying, like learning about I Can Study,
Yeah.
I can know that a good teachers
Yes.
and really expert is two total different things.
Yes.
If you are really knowledgeable, but you don't know how to teach,
Yes.
in terms of in the education point of view, you're
Yeah.
just a shit as well.
Yeah.
Because you don't know how to teach, you don't know what the student don't know, you don't know what is really teaching, how to make people learn what it is and just telling all the theories, give you all the theories, and don't give you the reasons how to apply it, why it is important kind of things.
Yeah.
Is different. So
Yeah.
I would say this kind of experience, but I think the physio experience in Oxford can direct me to a direction to know what I really want to be in, what I want to do in my futures. Do I want to stay in the hospital to like walking the patients for my entire life?
Yeah.
Probably not.
Yeah.
Probably not the physio I want to be.
Yeah.
I want to be a physio that help people with pain, and looking in different point of view to
Yeah.
treating the pain.
Yeah.
That's what I want to do. That's why I start to think about doing osteopath.
Yeah.
Osteopath is really the way that treating patient pain
Yeah.
in different kind of point of view. In the context of UK educations, just about the education, not about the qualified therapist. I would
Yeah.
say if you really want to focus on pain, private clinics, osteopath will be your choice instead of physio. Yeah.
Interesting. Can I just ask you, because you kind of told me offline about your experience about how the university managed
Yeah.
your situation after you failed. How was that experience? How did the university staff and like did they support you? How did it make you feel and in your point of view?
I would say the link lecturer teaching us MSK
Yeah.
is really supportive.
Right.
I know she liked me, so I can feel she really want to fight something for me.
Yeah.
I can see that. But on the other hand, because we suppose have educators kind of things in the school, what they call like support lecturers.
Oh, like academic.
Yeah, academic advisors. Because our academic advisor go back to the US,
Yeah.
and till that time I don't know who the academic supervisor is.
Yeah.
Until I remember that's the 2 week before the last week, which means I still have 2 weeks kind of improving myself.
Yeah.
At that time, the academic supervisors like email me that, do you want to have a talk about your placement kind of things? I say, yeah, sure, for sure. And then I asked, is it possible that we have a meeting next week kind of things or tomorrow kind of things? And he told me that, I'm sorry, I'm in vacations, so I cannot do that. And then I can only do the dates, which he can do it, is I remember it's 3 days or few days before the placement ends.
Okay.
The bullshit, like on that 3 day, what can I do? On that 3 day, what can I, even we have a meeting, what can we do in that 3 days?
Right. And did they know you're already in like a situation?
I think so. I think the whole faculty know it.
Oh, I see.
I believe people know it.
Like no one else jumped in and be like, oh, you're on vacation. This student needs, time to figure out the placement or like time to re-amend their placement. And like, no one else jumped in.
Well, yeah. At that time, I didn't tell other like lecturer that this tutor said that kind of thing to me.
I see.
I didn't tell it. I just directly find the mental support of the team, of the uni, like the Brooks like mental support team.
Yeah.
I think they're really good, to be honest. Like they are really supportive. They really counseling. Although they just like kind of like telling me kind of things, you can do meditations kind of things to calm you down, all the things, like all the things that I know how to do it.
Okay.
But they really trying to give me kind of support, give me some kind of thinking about what I need to do. In terms of support, there's no during the placement, to be honest.
Okay. When you failed the placement, what happened?
When I failed the placement, that also another interesting British experience. Like, not saying every British is like that, but you can feel the working style in British, like, if you don't push them, they don't give you back anything. You need to really push them to give you some things. Like, why I say that is because when I know I failed my physio, I start to find ways that what I can do now. I have few choices. First, quit the uni, go find a work, do a sports therapist here, or find another master degree to complete what I want to do in UK. Mm-hmm. I come to UK, one of the major reasons I want to get qualifications or certifications kind of things.
Yeah.
So I want to find another master degree to finish it. Mm-hmm. And then I just give them this kind of option to see what they can fit back to me.
Right.
And I can feel that they have never thought about anything about this kind of options that can give me. They just, I just feel like they do all the administration, admin things and kick you out. I have this kind of feelings. They don't give me any options for me to support what I can do next. And then all this kind of option is figured out by myself.
Yeah.
I will also give them credit that they really helped me to contact the other lecturers. Like I want to study the sport nutrition in masters in Brooks. Mm-hmm. They really helped me to contact the admin, like lecturers, like faculty managers, all the things. Help me to contact them. Mm-hmm. Yeah, that's the thing they do for me. And when I choose to study osteopath, the lecturers also help me to write kind of letters to the new uni to support my like English standard, all the things on that time. So, well, yeah, if you don't request things from them, they won't give you anything.
I see.
So I would say they won't be proactively help you. Mm-hmm. You need to do all the things as yourself as we study. Yeah. In the school, you need to proactively study by yourself. Everything's. You
need to be more proactive, even like administration things and all that stuff as well.
Yeah.
At the leaving part of it, you feel like they were able to support you in whatever it is that you were trying to request to do.
Yeah.
But instead, like they could have been able to be like, oh, like unfortunately you have failed the course of physio. Like now. Here are some of the options if you would like to continue. Yeah. They didn't do that.
They didn't do that. Like they just, I'm here. I can help you, but how can I help you? You figure it out.
I see.
Yeah.
I see. Interesting.
Yeah.
How are you feeling now, like about this whole situation?
Well, the first thing I would say, at that time, I really frustrating that about am I suitable to be a therapist?
Yes.
I mean,
Yes, you are. I'm telling you right now.
Yeah, I mean, at that time...
You are so smart, Bob. It's crazy. You have the highest academic score in our entire class.
Yeah,
okay?
I mean, yeah.
And it's like you're such a book smart person, and I think unfortunately like these work placements it's just a different ball game sometimes, and it's just not. Anyways, I'm just happy to know that you're kind of in a better place.
Yeah, thinking about that. But I mean, at that time I also start to thinking about, because I have a good academic.
Yeah.
Do I mean I have a good practical skills? I start to thinking like, in Hong Kong I'm like GPA is high.
Yeah.
Here knowledge so far so good. Compared
No, you're really, really good.
I mean, like that another like difference when I study in UK.
Yeah.
I'm not sure is it because of the master degrees or compared to the level of study, master compared to bachelor. I feel that it's so hard.
It's so hard, yeah.
To get, like here, if you get 70, you're already good. But in Hong Kong, you get not 80 is good. Like 70 for me is not just pass, but here 70 is good. Those kind of
the small nuances and differences.
The differences.
The marking is really different.
It's really different. But anyway, I think, well, academically, I feel that I'm good, but practically, I feel that I'm missing some things. Like, because maybe my work experience is not enough, and that's why it make me get into this kind of situation that I failed my placement, all the things. I start to hesitate about what should I do. I start to think about good academic is not meaning anything at all until you come out to work. Even when working, you have a good academic score, doesn't mean anything. It's the important when you're working is about really, can you really work something out from the book? Mm-hmm. That made me feel, that made me have a deep thinking about that at that time. And I know that when you're learning any new things, new knowledge, at the end of the day, you still need to practice it out.
Of course, yeah.
Like 80 practice and 20 is learning.
Yeah.
So I think practice, it just hit my short ends.
Yeah.
Like practically work things out. From now on, I'm still not really sure can I do it properly, because I'm still not in the clinical times, like not in the clinical hours yet.
Yeah.
That the challenge I need to face in the futures, coming futures as well. I have a worry about that. Well, when I'm really facing a new patient, can I really treat the patient properly? Can I really assess that patient properly? Can I communicate with that patient properly? It really a new challenge for me that I need to face, but I'm not sure really how the things going on in the futures. I mean, it just, this kind of experience really remind me what the weakness you are, what the strength you are, which kind of area I need to keep improving. So yeah, just see how the things going on.
I don't think your quote unquote weakness is not necessarily because it's something that you're not able to get.
Yeah.
And I think like me and you have a different age gap in terms of just like my work experience is quite different than what yours are.
Yeah.
And in terms of what you're lacking right now can only come from work experience.
Yeah.
So I hope that you failing your physiotherapy degree does not deteriorate you from your amazing brain of being a therapist. And right now you're on to the program of osteopath, right?
Yeah.
In which uni are you in now?
Which is a British College of Osteopathic Medicines.
I just think these things just comes with practice.
Yeah.
And I hope in your future it's just gonna come just a little bit more grace from your educators. And I think maybe, I don't know if this is something that you can potentially pre-communicate to your educators before you start the placement. Is that like, hey, there's a lot of things I don't know. Yeah. And then if you're gonna preempt them, these things, a lot of people will be like, oh, like I need to be able to take care of you. You know what I mean?
I think our placement on clinical hours is totally different from physio one.
Okay.
Because our clinical hours or clinical working, like the time you work in the clinics, in terms of the safety point of view, because all the people coming here is more like general population, although they may have some kind of diabetics, may have some history of stroke kind of things, but they are not dangerous as
it's not like acute setting.
No, not acute as the patients that we see. We care about contraindication kind of things, but those signs of contraindication will not directly kill the patients. It just like kind of reminded of us, oh, this patient may have this kind of contraindication. We may need to contact the GP kind of things. It's not about, it may change our treatment approach, but it will not really lead to a really risky situations.
Yeah. Oh my God, you're telling me this now. I'm getting stressed with my new work.
Oh yeah. I think it's just different things. At the same time, our clinical hours we do, actually they really not going to fail you or pass you kind of, they're not grading you how the performance in the clinical hour, because we still have the final clinical competency assessment.
Okay.
Which means there's external examiner come to see you how to see 3 patients.
Okay.
So they will really mark you on that 3 patients instead of the whole placements.
Oh, so it's a little bit different.
Yeah,
it's like a Viva.
Yeah, more like a Viva setting. And those patients is real patients. So in the clinical hours, you can do your best, you can fail, you can try your best, you can practice how to communicate the patient, all the things. That's what I observe currently. What I can observe from those kind of the year 3, 4 student doing. Mainly the educator will ask you about like, they want you to go through what your differential diagnosis kind of things. They will lead you instead of like judging you that you're not doing good that way, not good that way. I think I can feel that the environment is more supportive. It gives you like room to fail, and they won't mark you in the whole clinical.
Well, when you get into the placement, maybe we'll have a chance to chat about like,
I was looking for it.
Yeah, we can chat about that.
Compare about that.
Yeah, I would love to know like what your new experience is. One of the really main things that we connected really well during our physiotherapy is we have an interest in therapy treatments that is not necessarily traditional. And we're so interested in other aspects of treatment that's a complementary towards therapy. And do you think in your program in osteopath versus physio, is osteopath more acceptable in those alternative treatments? Obviously, evidence-based, but is it more okay to practice those in a clinical setting versus like in physio? It's like kind of like, no, just don't do it on your placements. Once you are qualified, then go ahead,
I would say all the things we talk about until I started this program, I can say all this kind of things from osteopath. Those kind of fascia concepts, visceral concepts, craniosacral therapy things, it's come from osteopath.
Interesting.
So at that moment, that also another big difference between physio program and osteopath. When I stay in the physio programs, I just feel like a lot of things I cannot talk about that. I cannot talk a lot of things to the lectures. I feel like a taboo things.
Yeah, same. Okay.
I feel like taboo things. They will think like you're woo-woo or like more evidence-based things. But when you talk in the osteopath settings, everyone have the same mindset. Even the library got the anatomy training in the library.
Wow.
And there's too many things I can talk about in the osteopath settings.
Oh my God.
So that's why I feel I also say thank you to physio that, I can go to osteopath to see, actually this kind of things I can see.
This is what you like.
That what I want to do, what I want to think in. Although osteopath now is a kind of in a debate between classic osteopath or like a classic and evidence-based osteopath. It's kind of a really hot topic between osteopath because if you want to adapt to modern medicine, you need to be evidence-based.
Yes.
But if you become evidence-based, fully evidence-based, the osteopath, the philosophy of osteopath will be fade out. Because there are a lot of things like visceral, craniosacral, fascias kind of things. You cannot fully establish in the evidence-based settings.
Yeah.
Very strong debate between different kind of perspective. I would say physio, like a lot of physio can do work as an osteopath.
Yes.
And osteopath, a lot of osteopath can work as a physio because a lot of osteopath can be very orthopedic based, very evidence based. So I would say in terms of educations, if you want to learn more when you're studying, when you be a student, osteopath will be a good choice. But after you qualified, everything, either you're a physio, either you're osteopath, either you are even a chiropractor or any therapist, you can practice differently, like practice the way you want.
Yeah.
So
because they're all kind of interlinked in a certain aspect, right? Because every other course you're going to take after your credentials, like you're basically going to be able to use these extra tools to help with like your future clients and patients.
All the same. We just start from a different point.
Yeah.
But end up with a ultimate outcome is help the patients.
Yeah.
Just different puzzles.
It sounds like you're in a much better place compared to like in physio now. And I think you have like this realization of you had this new path of osteopath and you're able to speak about the things that are quote unquote taboo when you were in physio, and now you can speak about it in class with like your lecturers and your friends in the new uni, right? You know, one door closes, many more open.
Yeah, that's true.
Sometimes it's so hard to see these things at the moment, especially like on the day when you like fail physio. You're like, oh my God, what the fuck am I gonna do? Like this and that, right? Like you obviously, now that you're here, how many months has it been? Has it been like almost a year now?
Yeah, almost a year.
Yeah, so like a year later, like you look back and you're like, oh, like I'm at a much better place at like these, even though like I'm still working on the credentials and stuff like that, but like you're discovering new things. I'm super happy for you and I can't wait to talk to you a little bit more about once you go on placement.
Yeah.
I want to change subject a little bit. I know that we've been kind of on here for a little bit long. We had a fun time going to Santorini together with me, you, and your girlfriend. I just want to like reminiscent about our trip a little bit. I think for myself, that is definitely one of the most beautiful places I've ever been to. And I'm so thankful that it was you who was like, let's go to Santorini. And then I was like, hey, let's go to a trip together. And at that time, we both did not have a good time like leaving our placement, right? So it was like our little vacation thing to like kind of get our minds out of it. And it was really nice for me because I didn't have to plan shit. And you did all the planning and it was fantastic. Yeah, so I'm really thankful for like the memories and all the photos, and like those are like the best photos I've ever had in my life, and they're fantastic. And I think, definitely one of the best trips I've ever had. So I want to thank you for that. What are some of the highlights that you enjoyed in that trip?
Well, I would say first of all, go to the beach. Like the beach is so beautiful.
Oh my God, yeah.
Like, and after staying in UK for like half a year, and the first time we really go in the beach is really good as well.
Yeah, it's different.
And the driving experience is good because I first time driving Europe and driving like a left side.
It was scary, man, being in the car. You were like you were going on like lanes and stuff. I was like kept on yelling at you. I was like, yo, please, I don't want to die.
I mean, like I'm getting better because like, you know.
That's good.
Yeah, the last year I gap time in Canada, I do a like Uber drive, like Uber delivery.
Oh, amazing.
for a month, so probably much better driving skills.
Congrats.
And then the driving experience, like because it's the first time really get out from my parents and driving by myself and someone, and then in a new place and a good place. Yeah, I think the driving is really the highlight for me.
It's fun, right?
Yeah. Driving yourself is really good as well.
Yeah.
And you don't need to wait for the bus. And yeah, I'm really fortunate that I choose to drive instead of taking bus in Santorini, because I know that in Santorini, like if you wait for bus to
take forever.
Yeah, take forever.
Yeah.
And then you can spend like different place in Santorini. Like you can go from there and there much faster. You can choose where you want to be.
And we stayed at like a really nice, like cheap hotel.
Yeah, that
with
one,
like amazing breakfast. I took full advantage of that breakfast.
It's good to have breakfast. And swimming pool as well.
Oh my God, yeah. I mean, we didn't use the swimming pool because we went to like the beautiful beaches and like all the sightseeing. And yeah, that's definitely one of the best trips I've ever had.
Yeah, I want to go in other Europe countries sometimes, maybe.
Okay, well, let me know because I would love to not plan and just tag along.
Let's see.
Okay, should we call it quits? I think we've done long enough. I hope you had fun.
Yeah, it's fun. It's fun. Talk shit,
hopefully you can come back and then we can chat a little bit.
Yeah, sure.
Okay, well, that's a wrap for today. Don't forget to subscribe and follow Slice of Anecdote for more real life stories. Spread the word, share your thoughts, leave a comment. Please take care of yourselves, and we'll see you on the next episode. Bye.